Not sure. Awesome.
Williams, there you go. And Isaiah, let's line up your kids right here, like in a row. A little bit of social distancing, but all the speaking would be.
So it would be Hussein. Yes. Where's Kim? Where's Kim? Kim. Yeah. Elliot and Laura try to get back. Kim.
So anyone else that's not speaking, and if you're not for the shot, we're going to have you down the side.
Yeah.
Down on the. Are you going to be in the shot? I'm not speaking.
Hussein. Hussein.
Kim said, I think John is speaking instead of her.
Okay.
You need to make sure. Kim.
So no Dr. Purse?
Who's speaking on behalf of Kim? John? I need him.
Hey, what was the other name outside of John? What was his John? Mayor and the Congresswoman have routinely been role models for U of H students to count on as they truly represent the people. On behalf of everyone here today, I would like to thank both of you for your service and dedication to the city. I would also like to thank Dr. Walker, Vice President Smith, Assistant Vice President Kolwaka, Student Center Director Esch, for their hard work on this initiative. Time and time again, U of H's administration has proven that they are here to support their students and uplift voices for a common collective. To the Houston Health Department, we want to thank you for becoming a model that is inspiring a generation to get vaccinated, as none of this will be possible without you. I would also like to thank Councilmember Shabazz for being in attendance here today, and Dr. Spann as well, because again, we really would like to thank all of you guys for your service to this city. You know, today marks the first day of complete eligibility for adults to receive the COVID-19 vaccine. And while we've come so far, I want you all to think about what your life was like last March. Over the past 12 months, hundreds of thousands of Americans would lose their lives to the invisible enemy known as the coronavirus. Millions would lose their job, and our economy would collapse at a rate none of us had ever seen before. Before our very eyes, life as we knew it would be forced into a new reality. Pleasures we willingly took for granted would become nothing more than distant memories stuck on a clouded shore. Thankfully, through the grace of God and the innovation of countless scientists, we now have an answer that can curb the coronavirus's ruthless path of destruction and bring a new dawn to America. We now have 3 vaccines created by American ingenuity, all of which are on a one-way path to bring herd immunity to a country who's been rocked to its core. Around the world, while many Americans will take this vaccine without a second thought, it's important to understand the gravity that is this achievement. There is nothing that we can't do to make up for empty chairs at kitchen tables, lost conversations with loved ones, and even the excruciating mental fatigue that's been placed upon our healthcare workers. We must never forget the horror they went through to get us to this moment. In America, we have a rallying point. We have a rallying spirit, and during defining moments, we always rise to the top at moments of adversity. Throughout my 4 years here at the University of Houston, we've seen tragedies every single year. Whether it's been a devastating winter storm, a torrential hurricane, or even a once-in-a-generation pandemic, time after time we've strapped our boots to the ground and risen to the occasion to build back better. And I'm so delighted to be joined here today by 18 different organizations here from the University of Houston who took the leap here to participate in this campaign. We're excited to launch the Take Your Best Shot initiative, in which U of H, TSU, and St. Thomas are all competing to see which school can get the most vaccinations for registrations for its students. So participants will tweet out and post with the hashtag TBSUH, TBSTSU, and TBSUST on all tweets and posts on social media. Now, look, you guys know I'm probably a little biased, but I have no doubt in my mind that just like our basketball team, we will win this challenge. All right. Come on, guys. Come on, give me some. Come on, guys. Come on. All right. So I now have the honor and the privilege to introduce our great mayor, our U of H graduate and proud supporter of our Houston Cougars, Mayor Sylvester Turner.
Thanks, Isaiah, and that's a tremendous challenge there. To all of the representatives of the various student organizations, it's good to be on the campus of the University of Houston. It's good to be in the District of Destination, District D, represented by Councilmember Carolyn Evans-Shabazz. Good to be with you again. And it's good to be here with all the representatives, Director Williams from the City of Houston Health Department, Dr. Purse, our medical officer for the entire city of Houston. I know Congresswoman Sheila Jackson-Lee is also sponsoring this particular event. Dr. Stephen J. Spann, the founding dean of the College of Medicine and vice president for medical affairs for the University of Houston. Of course, Isaiah, University of Houston hashtag for the student's president. Texas Southern University SGA Vice President D'Angelo Coulter, and University of St. Thomas Student Body President Kim Nguyen, along with everybody else. I want to acknowledge the University of Houston Student Government Association, Lone Star College, and all of the fraternity and sorority organizations who are with us today as well. As of today, all adults in Texas ages 16 and up are eligible to get the COVID-19 vaccine. This means you and your friends can now register for your COVID-19 vaccine, and I hope you will do that. As young Houstonians, you have a responsibility to try to prevent large numbers of vulnerable people, such as your parents and older relatives, from contracting the virus and possibly spreading it, a deadly virus that has taken hundreds of thousands of lives throughout this nation. And that is why today I'm asking you to take your best shot. I kind of like that. Take your best shot and be a part of the challenge to get as many students vaccinated as possible. And of course, our job, working with the Congresswoman and others, is to try to get as many vaccines down here from the fairs to the state locally, so that we can have doses on these campuses, college campuses, so people can get vaccinated. Similar to last year's early voting college challenge, which was highly successful, Take Your Best Shot challenge will serve as a friendly competition between Houston area universities to see which school can register the most students and alumni to receive doses of the COVID-19 vaccine. And I want to acknowledge the students that will be taking the vaccine today. How many will be taking the vaccine today? Show of hands, how many are taking it today? All right. I've already had mine, so about 40. And I was one of the early students to take the vaccine. And so I want to thank them for stepping up. And again, our task is to try to increase the available supply so that people, students, when they want to take the vaccine, that they can have the vaccine available to do just that. So please, but in the meantime, let me emphasize this. Please get tested. I know the focus today is on taking your best shot, getting the vaccine. But for those who have not even gotten the first shot, okay, it is important for you to get tested. As Dr. Peirce and Director Williams will tell you, the number of people getting tested has dramatically fallen off. And so we still need to get tested. If you haven't gotten even the first shot, it's important for you to get tested so that you'll know whether or not you're infected with this virus and you can protect yourself and protect others from this virus. So please get tested, continue to mask up, and practice safe and social distancing. And then before I relinquish the mic to the Congresswoman, let me say tonight is a magical night, okay? And we are asking the Cougs tonight to take their best shot, all right? And so their best shot, I mean putting the basket in the hoop. So as they play tonight, whose house?
Whose house?
Whose house?
Whose house?
Tonight shall be Coog's house, okay? And then we're going to honor them by taking your best shot right here in Houston, Texas. Regardless of your campus, whether it's University of Houston, whether it's St. Thomas, whether it's Rice, whether it's Lone Star, or whether it's Texas Southern, it doesn't matter which college campus, as long as you take your best shot and keep everybody healthy and safe. Having said that, let me yield back to Isaiah.
Well, definitely. Thank you, Mayor Turner. We're all so proud of our wonderful Cougars. It's been a really interesting run this March Madness. So with that being said, I'd like to introduce the hardest working woman in politics, our very own Congresswoman for the 18th Congressional District, Congresswoman Sheila Jackson-Lee.
Thank you, Isaiah, and thank you to the whole team. We don't just have a team on the court, basketball court, but we got a team right here. I want to give this team a very big hand. I love it. I love it. All right. All right. Thank you, Mayor. Thank you to Councilmember Shabazz. We're in her great district. We're very appreciative of it. To your whole healthcare team, Dr. Peirce, Dr. Span as well, Stephen Williams, who heads up the health administration part of it, the city health department. We thank them. Let me acknowledge, of course, Brother Coulter D'Angelo from Texas Southern University, and you are in the house. All right. It is good when we can see this kind of partnership, and let me acknowledge, as I know U of H would, TSU, and its great historic march into the NCAA. We thank you for your leadership as well. We thank Kim Wynn, Student Body President, University of St. Thomas. Delighted to have you in the house as well. Let me thank the distinguished members of the Chamber and Friends Extended for the great work that you do. Thank you collectively for all the charitable work you've done for us. So let me just indicate that we are on a journey. In fact, we are on an Olympic journey. This is the year of the Olympics. They are determined to have it, and we're determined to have an Olympics in the race for vaccinations. In the United States of America, we've done barely 15% of what is about almost 400 million people. I say that we have not finished our census. We were 335 million, and I know that we are now moving beyond that. And we're about 15%. The state of Texas, we're about 12%. So this is a great challenge. Mayor, thank you so very much for being at the forefront. We were here together, I think, when we were kicking off another effort to ensure that our students are never left out. I want to thank the city of Houston for being a star city, at the front of the line for testing, at the front of the line for the right approach to stopping the spread of COVID-19, and at the front of the line now for vaccinations. So this idea that Isaiah gave, he's another late night caller, or maybe I'm calling him late night because I'm returning his call, but at least he answered it. Let's hope he's studying. In any event, this idea was something that came to mind, and again, we are embracing not tomorrow's generation, we are embracing today's leaders of today. Let's give them a very big hand. They are the leaders of today. So we are here to be able to take your best shot. Hashtag for the students. Hashtag for whom? Hashtag? For the students. Can't hear you. Hashtag? For the students. For the students, to take your best shot. Let me say that in the meetings that we will have with the president, one that we'll have when I return back to Washington, I want to make sure that I highlight the city of Houston, highlight the county that the city is in, but highlight this local leadership and highlight our students in this program. For what I view this program as is accepting the challenge, Mayor, that the president has said. First he said 100 million, now he wants 200 million done. And what better approach than to say to all of our students who will be moving around, moving into new positions for seniors, moving back to family members, moving to go see grandmother and grandfather and other extended relatives, that you're taking the leadership role to make sure you take your best shot. And let me be very clear. This is a journey that is not yet completed. We know statistically today that we're on an uptick. We're on an uptick in the nation. We're on an uptick in this state. The variants are still here, and we have a circumstance where if you're not vaccinated, you can't even make the first step of fighting against COVID-19 or fighting the variants. So that's why I think today is so very important. I think the competition is very important, and I also think the idea that no one should be languishing somewhere and saying they can't get a vaccination. So the work that is being done at Del Mar, the work that's being done at NRG, the work that's been done in the local satellites that the city has set up all around, we hope to complement them by doing the work in the neighborhoods to make sure that people continue to be vaccinated. I said this early this morning, and I want to speak to my friends. They call themselves conservatives, conservative Republicans, since we're all bipartisan here. Let me make sure that everybody, no matter what your political philosophy is, and that's good that the students, they're going to go to whatever their family's political stance is, it's a good thing to get vaccinated. And if you all are role models, there's nothing like a family being proud of that kid in college. They're so proud of you. We're so proud of you. And you can be a real role model for those family members to say it's okay to get vaccinated. So let me indicate what a good place to be. I know I can't compete with the alum here. That's Mayor Sylvester Turner. But I'm on my way. I've got to leave quickly because they're waiting for me to make sure I get on the team up there where they are. University of Houston, nobody seems to think so. I'm getting on a plane so I can make that dunk for you. You're going to see me on the basketball, all right? I can't stay here, but let me just say how proud we are of the hard work, tenacity, and strength and character of the University of Houston basketball team as they have made their way step by step, basketball by basketball, play by play. And tonight, I don't want anybody looking at anything else but rooting our team on. And one thing about Houston, we are a city of neighbors and neighborhoods, and we're united. And we're going to have that united spirit. You see, I couldn't wear more red today. I'm all red up. You didn't see I had my grandchildren here. They couldn't come up. They might have been a little bit too rambunctious. They had on red. Go Cougars, just like go Cougars. And just like the mayor said, whose house? Whose house? Whose house? Whose house? All right. Jackson Lee is on the way. Make that dunk, all right? Get vaccinated. Thank you.
Thank you again to Congresswoman Jackson Lee and Mayor Turner, because none of this would be possible without the hard work of both of them and to Houston Health as well. So let me turn over to our student leaders, three of which are here today. We have Hussein, who has really led the efforts of our For the Students response to coronavirus. He's been there. He calls me again at 2 o'clock, 3 o'clock in the morning, but it's all because, we really want to try our best to encourage all students to get vaccinated. So without a doubt, Hussein.
Thank you, Isaiah, and likewise, none of this would have been possible without you. Good afternoon. I've prepared a few remarks for you today. My name is Hussein Taibji, and I'm a student here at the University of Houston, studying industrial design in the College of Architecture. My parents actually met here at the University of Houston, making me a second-generation Cougar. I was born and raised here in this amazing city and want to help better it in any way possible. I want to first thank Mayor Turner and Congresswoman Sheila Jackson Lee for taking their valuable time to come here today and help make this happen. I want to also thank President Renu Katur and the University Administration for their support here today, as well as Ms. Dooney Hebron, epidemiologist Mr. Fred Brown, and my father, Abizer Taibji, for their consistent guidance. The last few months have been very encouraging because vaccination efforts in the U.S. have been in full force. This really means that we are given opportunity to focus on the younger generations, as we are key to building herd immunity. Recent surveys show that up to 75% of students are willing to take the vaccine, so it is our desire to first find the vaccines to get them vaccinated. Second, focus just as much on the 25 to 35% who do not want to get vaccinated. And lastly, we will focus on helping vaccinate neighborhoods in our surrounding areas. It is time to stop politicizing this vaccine and trust the men and women who dedicate their lives studying medicine to better humanity. Finally, Isaiah and I are committed to using our platform to lobby the White House and Governor Abbott to procure between 6,000 and 30,000 vaccines for Houston universities and our surrounding neighborhoods. Hopefully together, we can defeat this virus and make our beautiful city of Houston safe again. Thank you all very much, and go Cougs. Thank you very much.
Thank you, Hussein. That was amazing, for sure. Now, I really would like to actually turn over to Dr. Stephen Spann, who's the founding dean of our College of Medicine here today. Dr. Spann, thank you so much.
Thank you.
Well, good afternoon. It is great to be with you. Congresswoman Sheila Jackson Lee, Mayor Turner, our friends from the City Health Department, our visiting students and other visitors. We're so glad to have you here. Thank you for your support of this event. I really want to congratulate and honor these students for their leadership in stepping out to role model the importance of vaccination. We've heard about it this afternoon. It is an effective, efficacious preventive measure. The risks and side effects are minimal, and we believe that getting to herd immunity, getting at least 80% of our population vaccinated, is key to getting out of this terrible pandemic that we've been in for over a year. We at the University of Houston, at the University of Houston College of Medicine, are dedicated to improving the health and the health care of our community, and we are likewise dedicated to finding ways to vaccinate our community and get vaccinations in as many arms as we can. Our Student Health Center has embarked on a vaccination campaign for our students and our staff and our faculty. We've already delivered over 2,300 vaccinations and hope to deliver many, many more in the coming days. So your leadership, your role modeling, your education of the broader community, not only the student community, but our larger Houston community, will make a major contribution to our united goal to vaccinate the majority of our population and to achieve herd immunity. So congratulations, best wishes to each student group in the competition, and go Cougs.
we definitely thank you, Dr. Span, for everything you do for this university. We really appreciate it. So next, I would like to turn over to Mr. Stephen Williams, the Director of the Houston Health Department.
Well, thank you, Isaiah. We were talking earlier about the fact that this event actually occurred over a matter of 2 to 3 days. And so thank you to everyone who was willing to pull this together. You know, as a public health professional, I'm really excited to see young college students' willingness to stamp out COVID. Your leadership on this issue is unrivaled in this city. I am so grateful that you're willing to take your best shot. And the way that you can take your best shot is certainly to demonstrate that, walk the talk. We're hoping that by you taking your best shot, that those that you associate with on a daily basis will actually follow that. Let me give you an idea of how you can actually take your best shot. I encourage you to go online to alerthouston.org. That is a website that you can sign up to get an email, a text message, or a voice call, or a mobile app notification with opportunities for you to take your best shot. Of course, if you don't want to do that electronically, or you can also make a phone call. You can call our call center at 832-393-4220. It's important that we take our best shot, but as the mayor said, we can't really let our guard down. We have to continue to wear our masks. We have to continue to social distance. We have to continue to get tested. It is important that we put all of this together if we're really going to tackle COVID. And I just want to really express my gratitude for all of you to coming together to ensure that not only adults, but young adults also take their best shot.
Well, thank you, Mr. Williams. I can make the commitment that all of us students will do our best to take our best shot with this initiative. Next, I'd like to introduce our wonderful councilwoman, Ms. Carolyn Shabazz. Thank you.
Thank you, Isaiah. It's always great to be on the campus of the University of Houston. I like hanging out with my age group, but somehow this hair kind of gives me away. But certainly I'm going to just cut to the chase. Don't wait. Vaccinate. So please, this is so vitally important for this age group to certainly know that they are key to us getting herd immunity. You are in and out and very social. And so we need to make sure, in spite of what you may have been told, you are and can be affected, and you can certainly carry it to your family members. So I'm so very appreciative for young people being here. I did take a couple of classes at the University of Houston, so, you know, I have my heart here for University of Houston. Of course, I'm an alum of Texas Southern University and Spelman College in Atlanta. But certainly I know that this is going to be a great, great effort. And I certainly wish the best to the Houston Cougars. And I was taught the signs, I'm gonna get it right. Go Cougs.
Well, thank you, Councilmember Shabazz. You know, like you said, we all want to do this Go Cougs today because this is a tremendous day. And, you know, we're ready. You know, we're excited to see what we do tonight. So next, I would like to turn it over to D'Angelo Coulter, the Vice President of the Student Government Association at Texas Southern University.
Thank you all so much. First, I'd like to say thank you to Mayor Turner and Congresswoman Sheila Jackson-Lee for this initiative and everything that you do for the people of Houston and Texas 18th Congressional District. Also, thank you to our Councilwoman, Carolyn Evans-Shabazz, for truly being here, and also your work that you do for District D. Also, thank you to the faculty, staff, and students at University of Houston for ensuring everyone's safety here, as well as the Houston City Health Department. Thank you for all of the frontline workers and everyone else that truly works diligently day and night to ensure that all adults are staying safe. I would also like to thank everyone at Texas Southern University for truly ensuring that TSU students are also maintaining safety, as well as truly offering vaccines to all ages. And even though, I am at, the University of Houston's home, Texas Southern University will always have a place in my heart. And we are very excited to take upon your challenge for Take Your Best Shot. And lastly, I want to say, I wish y'all the best of luck tonight. I wish y'all to make home to victory safely. And also, go Tigers.
For all of you guys that don't know, U of H and Texas Southern actually shared a home, when during the construction of the Fertitta Center. And I remember a lot, during my younger years here at the university, going over to their campus and really becoming familiar with their great history on their campus. And, actually my mother is also an alumni of Texas Southern University. So we're so proud of our neighbors at TSU for their tremendous run in the NCAA tournament as well, and we definitely celebrate them as our neighbors. Next, I would like to call the representative from the University of St. Thomas. Okay, awesome.
Yes, my name is John Tran. I'm from the University of St. Thomas. I would like to first say that I have a grandmother who's in a nursing home right now. Haven't been able to really visit her this past year because of COVID. Taking these first steps towards seeing her, this is an incredibly grateful opportunity. So I truly thank all of you. Thank you. I know I speak on behalf of the University of St. Thomas that we are thankful and grateful to be part of this citywide initiative and competition to take our shot. So I speak on a personal basis to not only UST students, but all college students. Take your best shot, get vaccinated. This is the way to do it, and I truly look forward to being a part of this competition. Thank you very much.
Awesome. We definitely thank the University of St. Thomas for participating in this challenge, and also our friends at Lone Star College who are not able to attend right now. But with that being said, did we miss any other keynote speakers?
I think it is important to hear from Dr. Peirce in terms of what all this means, not just for our college campuses, but what it means for the city of Houston. So Dr. Peirce, if you'll come.
Thank you, Mayor and Congresswoman. Thank you for being here with your very tight schedule. Isaiah, congratulations to you and your colleagues for putting this together, especially on such short notice. I want to put it in a little bit of perspective. When we started this, the most vulnerable people were those over 65 years of age, those with chronic illness. And so we've been putting a lot of effort towards protecting those people. And there are still many of them who need to be protected. But we are fortunately at a point now in Texas where we can start broadening and start vaccinating others. And what we're seeing is that the number of folks who are becoming infected and the death rate is decreasing. The total number of people in Houston that are becoming infected is decreasing. And this is all due to those hard efforts. And as we look at the age groups, those that are becoming infected, unfortunately, the average age is becoming younger. Well, that's not because the younger people are doing anything wrong. It's because we're doing such a good job with the elder folks that they're not becoming as infected. And to your point about your grandmother who's in the nursing home, we put a lot of effort in protecting folks in nursing homes. So things are moving. This is good. This is exactly the time where we need to shift gears and start getting young people vaccinated. And I cannot think of a better way to get that kick-started than an event like this. So your timing is perfect. And so I really hope that the students will take advantage of this challenge, as students are known to do, and become competitive, all for the right reasons, and step up to this challenge. And one other thing I want to point out, a little bit of a science update today. So the Moderna and Pfizer vaccines, when they came out, we all saw they were 94.5, 95% effective. And so that was at people who became symptomatic. And so there's always that question, but what about the people who got infected but didn't have any symptoms? How many of them were there? So just today, the CDC has pointed out through their studies, a very elaborate study looking not only at people who became symptomatic, but whether they even got infected and had no symptoms. And those vaccines are now known to be 90% effective in preventing people from even becoming infected. So with that, we really can. we really can get ahead of this virus. And at the same time, while the numbers are getting better and better here in Houston, we are hearing that they're getting worse in other parts of the nation. So to some degree, we need to worry about the fact, is this the eye of the storm? And if it is, this is the time for us to push the vaccine and get it out. So on the back side of the storm, it's not the dirty side. So on the back side of the storm, it'll be the clean side of the storm if we should have to see what's coming, as we're seeing everywhere else. So I cannot thank you and applaud your efforts enough. You really should be proud of yourselves. We obviously are all very proud of you. Go Cougs.
Well, thank you, Dr. Peirce. We definitely appreciate, everything that you do for this wonderful city that we all call home. Getting mixed up with my papers here. Okay, so with that being said, that concludes our list of speakers for today's event. But to everybody here in the crowd and to everybody that will be receiving this vaccine, I want you all to envision who you're receiving this vaccine for. Whether it be your mom, your teacher, or the unknown man on the other side of the bus, we are in this together because, again, we are in a new dawn of America. Several years into the future, we'll think about how we rose against all odds to defeat the biggest enemy of our lifetimes. And once again, just like always, America will have prevailed. Our new dawn will start a movement that will send shockwaves throughout this city, shockwaves that will bring us back to the state of normalcy and bring us back to pursuing a greater tomorrow. Together and collectively we'll get through this because, again, we're one nation, we're one people. God bless this University of Houston. God bless the great state of Texas, and God bless these United States of America. Thank you, guys.
Is there a program or a plan? Is there a program or a plan to get residents in the surrounding areas to get vaccinated that may not have vehicles or modes of transportation?
Yeah, let me speak to it, and then let me ask Director Williams to amplify my responses. As you saw, for example, on Saturday of this week, the City of Houston Health Department, working in collaboration with other partners, we were all over the city of Houston. So, for example, we went from the northeast at Harvest Time Church in the Greenspoint area to Windsor Village in the Gulfton area in Southwest, and then to Wheeler in 3rd Ward. So those were 4 sites. We will continue to go to sites within the community. I know Congresswoman Sheila Jackson Lee was just at Booker T. Washington in Independent Heights today. So the goal is to get out into as many of these community sites, in addition to our stand-up sites like at NRG, or at Del Mar Stadium, or at the Bayou Center. And so it's getting out into community sites, just like today, take your shots. This is getting to the universities and the community colleges. And then the additional element will be to set up mobile units that can actually go to various apartment complexes and communities within the city. And then the City of Houston Health Department is already, on a limited basis, going into people's homes for people who are truly homebound, cannot get to a mobile site, cannot get to a fixed site. The health department is already going into people's homes and providing the shots to people who are homebound. And let me ask Director Williams to amplify that response.
He's
going to speak in Spanish.
He didn't know I flunked Spanish in 9th grade. But the mayor's absolutely correct. As a matter of fact, I was talking to Dr. Spann, and we traded emails today where we were working on a partnership to actually target housing complexes. We will actually go into those complexes, but we wanted to do it in conjunction with the med school here. We do have a service where we will go into homes
of people who are actually homebound. You can call 832-393-4301 for those individuals that are homebound. As vaccine becomes more available, we will have more community-oriented sites. But even today, we have 4 health clinics that are strategically located within neighborhoods where people could actually walk to get a vaccine. Also, if people are having transportation issues, we do provide a level of support for that. You can call that same number, 832-393-4301, for assistance with transportation.
One last thing, Councilman. Because I do want to bring up also Jack Deep, who's with the Indo-American Chamber. Jack Deep, why don't you come, because there are other sites that have been made available to us, because we live in the most diverse city in the United States. So it's important for us to reach out into that diversity, and in partnering and working with the Indo-American Chamber, we can expand our reach.
Thank you, Mayor.
And then I know the Congresswoman.
So we have a member of the chamber, Drill Quip, and they've been reaching out to us to say that they would like to demonstrate that they and their employees stand behind the mayor and the Congresswoman's efforts to get every one of their employees vaccinated. So Drill Quip has offered their site to have a team come in and vaccinate all their employees who are eligible. And as of today, it seems everybody who works for them is eligible. So that's the contribution that the chamber would like to make to this effort to prove that we are all behind it. Thank you very much.
Your question has triggered a lot of answers. Before I do that, I do want to, Mayor, and I'm very glad that you're partnershiping with the University of Houston. I did not emphasize enough Dr. Spann as the founding member of the University of Houston Medical School, but the idea of the medical school is a neighborhood-based or a community-based medical school. It is in actuality to train doctors to actually do their practices in neighborhoods, and I would say low-income neighborhoods across this state, but across the nation. That is very unique. That is their direct mission, and how important it is that they are standing up the medical school right in the middle of this pandemic. By the way, the Centers for Disease Control predicts that we'll have another pandemic, and certainly the director of the Centers for Disease Control, who is certainly more transparent than what we've had before, has indicated that the variants are here for a while. And so we may have known COVID-19, but the UK variant is here and other variants are here. So I think this idea of the teamwork, NRG, Del Mar, the large sites, and then what I call the neighborhood initiatives. At Booker T. Washington, we're seeing people with walkers, people with various disabilities, literally walking from the neighborhood to Booker T. Washington. And so the more we can get sites in the neighborhood, the more we'll be able to answer the concern of those who are trying to get vaccinated. And that's how we begin to do, as has been indicated, I call it mass immunization, but that is to get the entire nation vaccinated, but more importantly, get a body politic of people who are sufficiently vaccinated to really stop COVID-19 in its tracks. And that is to work in layers. Large NRG, by the way, Mayor, I'm supporting and calling on your behalf to get NRG extended. NRG, 6,000 and above maybe. Del Mar, 2,500 a day, I think they're doing. Other large sites, and then neighborhood sites where people literally can walk to get vaccinated. You'd be amazed to see how many people do that, and what a service these sites that they will be utilizing will be using every manner of medical school. I have to mention other schools with nursing programs are all ready to be of help. We must do it that way in order to reach the goal that we have to reach.
You know, last week we experienced a small increase in vaccine. We don't really expect a huge significant amount of increase in vaccine for a couple of weeks. I'm a member of the expert vaccine advisory panel, and during the discussion today we were looking at the fact that Moderna has pretty much leveled off and stayed steady. We've seen some increases in the Pfizer vaccine, and everyone knows that J&J is going to be limited for at least another two weeks or so.
But do we know currently how many vaccines are receiving? Is that they're going to increase?
Yeah, we know, but I don't have those numbers with me. From the Houston Health Department standpoint, we've actually received the same amount of vaccine for the last couple of months. The exception would be an addition of 2,000 doses of J&J for the last 2 weeks.
We're going to change that.
What I will say, in order to meet our timeline and to try to reach the herd immunity as quickly as possible, to stay ahead of these 5 variants that we know are inside the city of Houston, we really need to be vaccinated. When you include the hospitals, the city, the county, the providers, about 50,000 a day in the Houston area. We know that's the goal, which means we have set up the infrastructure to handle as many doses that we can get, okay? So we know we can do NRG. We can do Del Mar Stadium, Bayou Center. There are other sites that are ready to provide anywhere from 3,000 to 5,000 a day. So if we get the doses, we can get them out. These colleges and universities, they're ready to go right now. I mean, today is the press conference. It's a very limited amount. But the more we can vaccinate on these college campuses, the better it will be for all of us. So we need enough in order to vaccinate in the Houston area, when you include our hospitals, the city, the county, the other providers, 50,000 a day, not a week. And if we do that, then we can get ahead of these variants, and the city can truly start to open up much sooner. So that's the goal. So going to count on the Congresswoman and others to utilize their influence. If the Congresswoman say do it, it will be done. So, you know. So I'm gonna tell the Congresswoman, take her best shot, okay?
Let me dial right now.
But I hope that answered it as best we can. Okay.
President, the mayor's calling.
Well, thank you guys again so much for being here today. Everybody else will be available for questions. We thank the mayor, the Congresswoman, and everybody else involved for their attendance today. Thank you guys so much again. Thank you.
Thank you. Okay. Nice to see you.
Quick photo, do y'all need that?
Yeah.